Well, my father was a small town doctor, so there was never any question that I was going to be a doctor, but the type of doctor changed quite a bit over the years. I initially trained in neurology because I was interested in the brain and consciousness and the nervous system, but I started to specialize in conditions that had genetic predispositions, and particularly Alzheimer's disease. And I got fascinated by the APOE genetic risk factor that is a gene for risk of Alzheimer's disease when it was just coming out. And I designed one of the earliest research studies that was funded by NIH to explore whether people wanted this information and how it impacted them. What was the medical, the behavioral, psychological, and economic outcomes of learning genetic information about yourself? And this was back in the 1990s when almost nobody was doing this. And it was very, very controversial before DTC, before anything. And then direct to consumer genetic testing came out. I think the earliest companies launched in about 2007. And all of a sudden, the work that I'd published on ApoE was highly relevant to what was emerging in the world of genetic disclosure. And at that point, I thought, wow, this is the most exciting stuff I've ever experienced. So I did something pretty crazy as a full professor of neurology. I went back and did a second residency 25 years after I'd done my first one.
Oh,
And
boy.
that second residency was in medical genetics. So I'm an experienced physician scientist, but was rather new to genetics. And then being rather new, I was able to bring some new thinking, different kind of thinking to some of the questions. That's helped me out quite a lot.